Hi, I'm Dr. Lili, and this is my Pocket Pediatrician. I saw a story that affected me deeply a few weeks ago. It was a story about a 13-year-old boy who had a severe dairy allergy. He was getting teased by some kids in school, and they were throwing slices of cheese at him. The boys who were teasing him stuffed a few slices of cheese down his shirt and ran away, and the young boy immediately went into anaphylaxis. He did get epinephrine, and he was transported to the hospital where he was in critical condition for 2 weeks before he died. The story is horrifying on so many levels. I don't think these boys were trying to murder this child. I really hope these boys had no idea how deadly their prank was going to turn out to be. So today we're going to talk about food allergies from a lot of different perspectives so that we can clear up some of the confusion surrounding food allergies. I've been working on a gun safety video for the last few weeks as well. And when I put a toy gun on the table and was looking at my children playing with it, it still kind of makes my heart stop. Even though I know it's not a real gun, I just don't like seeing that gun and my children so close to each other. For other mothers, they feel the same way when their kids are at a table that's got peanut butter on it, and something as innocent as a peanut butter and jelly sandwich can strike that same terror in their hearts that I feel when I see my children with that gun. So I just thought that was kind of an interesting comparison.
When the doctor says my child has a condition, I'll learn more at my Pocket Pediatrician.
I remember when I was in medical school, my roommate was dating a guy in a long-distance relationship. She sent him a care package, and he wrote her a letter back saying, "Your subtle attempt to murder me did not go unnoticed." She and I were kind of mystified by this, but it turned out he had a peanut allergy, and she had sent him some granola bars containing peanuts. At that time, neither of us knew anybody with food allergies except for him, and it just seemed really weird to us. This was back in the early 2000s, where food allergies were not nearly the problem that they've become today. Fast forward to 2018, and you'd be really hard-pressed to find a preschool that allows nuts in any form in there. Food allergies are in the news all the time now. There are debates on social media, and a lot of times it kind of takes on the tone of, well, you can't take away my right to feed my child peanut butter. And there's just a lot of discussion going on about it. Because food allergies impact so many people, and they also impact the lives of people who work with, live with, and play with those who have food allergies, I wanted to bring in 3 different moms who could share their perspective on how food allergies affect their children's lives.
So she's almost 3.5.
Them is 8.
Technically diagnosed at 4.5 months, but by a week of age, we knew that there was something wrong.
4 months. She had very bad eczema. She would scratch herself until she starts bleeding.
Are we blowing these allergies out of proportion? Are these kids all snowflakes that might get triggered by talking about fish or peanuts or something like that? Or is this a serious health issue that deserves a lot of attention and needs to be taken seriously?
The tongue just, I started freaking out. She was turning purple. Her cheeks were flushed and she had hives. She couldn't talk. She was just looking at me and her eyes were turning red.
We had to take her to an emergency room and put her on steroids and have her observed.
Driving and she's like, "Mommy, I can't breathe." So I had to stop and do the injection again on her leg.
I'm going to go with the serious health issue on this one. About 1 in 13 children have food allergies in the United States. That means there are over 6 million children living in the U.S. with food allergies. Most pediatric allergy offices have waiting lists months long, and it's impossible to get in to see them as a new patient. Between 1997 and 2011, the prevalence of food allergies increased in the United States by about 50%. Peanut allergies more than tripled in the United States between the years of 1997 and 2008. In those 11 years, a child's risk of developing a peanut allergy tripled. That's insane. So what is a food allergy? Food allergies occur when your body's immune system overreacts to a substance that should be harmless, like food. I think some of the confusion about food allergy comes because we use the word allergy to describe food allergies, life-threatening allergies, and also seasonal allergies. Allergy does mean that the body's immune system is overreacting, but sometimes we use it just to mean that's causing a little runny nose or some sinus congestion and itchy eyes, and sometimes it means somebody's developed a life-threatening allergic reaction and they could die if they don't get epinephrine immediately. There's a big difference between the two, but when a mom says my child has food allergies, somebody else might say, "Oh, well, I get hay fever too. I understand what that's all about," not really realizing how different the two situations are. So what foods are people allergic to?
Oldest is allergic to dairy. Middle child is allergic to soy and dairy.
Milk, egg, peanut, tuna, sesame, sunflower, and garlic.
That's right.
Shellfish, all fish, soy. She's allergic to MSG, tree nuts, seeds, wheat. She's also allergic to dogs and cats and feathers and,
and she's allergic to soy, dairy, and egg. And egg would be the biggest concern for us because she is anaphylactic to egg.
More than 170 substances have been linked to food allergies in people, but there are about 9 that continually show up to be the most common. These 9 allergens are peanuts, tree nuts, soy, shellfish, fish, milk, eggs, wheat, and sesame. About 30% of people who have food allergies are allergic to more than one substance. The most common symptom is usually a rash called hives or urticaria. These are flat red bumps that appear on the skin, and they often move around and come and go. Hives in themselves are usually not too much of a problem. Serious allergic reactions or anaphylaxis usually involves a rash similar to hives as well, but other symptoms start to appear like wheezing, difficulty breathing, tongue or lip swelling, throat tightness, sometimes vomiting or a drop in blood pressure. Once anaphylaxis starts, epinephrine or the hormone adrenaline is the only thing that can stop it. It has to be injected. No other type of steroids or diphenhydramine or other type of histamine blockers are going to be able to stop anaphylaxis. The only way to stop it is epinephrine, and sometimes it takes multiple doses. I discussed the case of the young man and the cheese with a few different friends, and a lot of people expressed shock to me that he died even after receiving epinephrine and critical care. A lot of people didn't realize that epinephrine doesn't actually always work. Sometimes you need multiple doses, and if there's a delay in giving that dose, the consequences can be fatal. The longer you wait to give it, the less likely it is to work. Because getting epinephrine to people is so time sensitive and it must be done within minutes of realizing that the patient is in anaphylaxis, the epinephrine auto-injectors were developed. This allows lay people, parents, patients, other people to be able to inject the epinephrine into the patient without actually having to have any medical knowledge of how to draw it up in a syringe, take it out of the little bottle, and all of that kind of stuff. If an epinephrine auto-injector is used, the patient should immediately be brought to the emergency department where they can get further monitoring, studies, and additional treatments if needed. About 40% of kids who have food allergies have experienced anaphylaxis. There are basically 4 types of epinephrine auto-injectors that are available on the market right now. All of the epinephrine auto-injectors are basically a preloaded syringe that has the epinephrine in it and a needle that's shielded from sight. Each one has its own mechanism that you can use. You basically hold it to the patient's leg and it will inject the epinephrine in. You can actually use these through clothing, and they're designed to be used that way because you don't want to waste time taking off pants or trying to get under the patient's clothes. You can go right through it and get the medicine in there as quickly as possible. The one that most people are familiar with is the EpiPen. The Auvi-Q is another type of epinephrine auto-injector, and it is actually a little bit different because it talks to you and tells you what to do in each step. It's also a slightly different shape. The other 2 types are called a generic EpiPen, which is basically the EpiPen, but it says generic on it. And then there is a generic epinephrine, which is a slightly different injector, but similar in mechanism. Make sure that you know how to use the device that you have. And a lot of people have more than one type of device. Make sure you're trained and comfortable using each one.
Auvi-Q, and we have the EpiPen.
There have been times where I've forgotten it and I've immediately driven back. Got to my destination an hour away and driven an hour back just to get it, just because I'd rather be safe than sorry. And then we also keep an Auvi-Q at her daycare facility, and then we have one at our family's house where if she ever stays anywhere, it's there.
Because it's extremely expensive, this medicine that is life-saving, but it costs a fortune. Most people cannot afford that.
Every type of epinephrine auto-injector comes with a trainer in the kit. It's a good idea to take it out at least once a month and practice giving yourself or your child an injection with the trainer so that you're comfortable and ready to use it if the need should arise. There are shortages from time to time, and cost is definitely an issue, so speak with your doctor if you're having trouble getting the injector that you need. Other alternatives may be available, or you may be able to find coupons or discounts online. Make sure you check out my video on how to use epinephrine auto-injectors, and I'll also give you a few practical tips on how to hold down children who are kicking and screaming when you're trying to do the injection as well. Sometimes the more times the person has an exposure to something that they're already allergic to, the worse the reactions can get each time. So these parents have no choice but to helicopter their kids. For parents of children with food allergies, they're often scared that a simple bite of a muffin or a granola bar could send their children into an anaphylactic reaction from which they don't return.
That a reaction will go too far and we won't be able to bring her back. That is my greatest fear.
Where I get major anxiety every day leaving for work, just being fearful that something might happen to my child and I might not even find out until it's too late.
My biggest fear is for her to be out there, even at school, and nobody will realize, and by the time they do, it will be too late. It's not a good place to be in. I'm sorry.
that somebody's going to bully her. I worry that somebody's going to slide something into her food because they think that her allergies are jokes and that something's going to happen, that she'll accidentally consume something. And we won't be able to rescue her.
I'm not going to be there because I can't be with her all the time as much as I'd love to be. And that something horrible is going to happen and that she won't get the right treatment right away and that she could pass from that. Whew, it's a little bit.
Food allergies impact almost every aspect of a person's life. Children with food allergies often experience social isolation, exclusion from their peers, and about a third of children who have food allergies report being bullied because of that food allergy.
It's like you cannot have a normal life.
Prior to the allergies, you're kind of carefree, and once you have some serious food allergies like these, it just changes everything in your daily life.
I actually had to quit my job because it was too hard to find a nanny to watch her, and I couldn't put her in daycare because of the number of allergies that she had.
I get literal anxiety leaving my daughter to go to work or to go do anything where I can't bring her with me. Because I fear that other people are going to give her the food that she's allergic to.
I stopped working because I cannot trust anyone to watch my kids.
There was a assistant hired who just wasn't used to basically the allergy protocol in the United States. She would sneak my daughter different types of food that she was allergic to.
I told them, by the time I get there, she'll be dead. So you might have to call an ambulance. A weekly thing, so I had to quit my job.
Her teacher is EpiPen trained. She had to take a 2-day training course on food allergies.
And we see a doctor for this. I buy expensive specialty groceries.
And she's also contact and airborne allergic. So
I haven't been back into Africa just because of that, because I'm worried, because I cannot let her eat food from the plane.
It impacts us socially. We can't go easily to parties where people are eating foods that she's allergic to, and even just going to a fair or going to the library.
Kids jump houses, things like that.
That actually has prevented us from going back to church and going to Sunday school because a lot of Sunday school teachers are volunteers. They're not trained.
So she's gone back to her diet of a lot of fruits and vegetables, which she doesn't like. And it's so difficult for me to pack a lunch for her. I pack for her like plantains, and she's embarrassed to eat that at school.
They sit her at a separate table in school so that she's not exposed.
She's going to get to elementary school and this is going to become a huge problem.
Kids are bullied for all of their other disabilities too. And
the other children feel left out sometimes because you're so focused on this one child and making sure that she's fine.
Going to restaurants is not something we can do. I have to bring her food.
We can't really eat out for big parties. My daughter can't have the cake at Thanksgiving or Christmas. I have to bring her an entire plate of food.
I don't like taking her to other people's houses. They don't realize how bad it is. They always think that I am overprotected.
Being like a hypochondriac or something, but it is that severe.
Caring for children with food allergies costs U.S. families nearly $25 billion per year. This is not just doctors and medical visits. It's also finding the expensive specialty foods that the children need, lost work hours due to emergencies, and all kinds of ways that they can impact their lives. So while I can't count how many children I've seen having allergic reactions and anaphylaxis, and I feel like I could manage them in my sleep, I know how to deal with the emergencies. I am not an allergist. In order to give you the best information possible, I had a few questions I wanted to discuss with an expert. And so in the process of kind of putting all these things together, I'm basically making a short film documentary instead. So what I'm going to do is break this video up into 4 different segments. So I have the basic intro to food allergies, which is this video. I have a video of moms explaining what life is actually like with food allergies. So if you want to get more in depth there, you can go there. I also have the how to use a EpiPen, a Auvi-Q, and a Generic Epinephrine Autoinjector. So that's a separate video that can be used as an instructional guide for anybody caring with children who do have any of the epinephrine auto-injectors. And then I want to get deeper into some of these questions, and so I'm going to be interviewing Dr. Vivian Hernandez Trujillo. But for time's sake, that's going to be a separate video. So make sure you check that out. It will be available very soon. And I'm really, really excited to be working with her. She is an amazing person. She's a pediatric allergist and immunologist who travels around the world presenting her research in conferences. And she also is a mom of 3 girls with food allergies. And as an adult, she also developed food allergies and life-threatening anaphylaxis. So you're really going to want to see this interview, and the link is going to be available in the comments below. So the purpose of this video is not to say, wow, this is a really big problem, just look at it. We're talking about food allergies in the hope that there will be a cure soon. We're talking about it in the hope that people will understand and that we can reach out and support those mothers who are struggling and find ways to give them a little peace of mind when they let their children come into our home. And when we find ourselves in a preschool or a Sunday school with a child with allergies, we can make sure that we can do things to keep those children safe.
The biggest thing you can do as a parent to keep our children with food allergies safe is to be sure to wash your child's hands and face before they leave the house after they eat.
I think it's really important for awareness that people know the reactions and how they can occur and just the different severities of what can happen.
And a lot of people don't realize that. I know I certainly did not realize that until I had her with my first child. He came out of the house covered in peanut butter all the time, and now I've just realized how dangerous that was for other kids.
That it's a struggle every day, and the measures that a parent with a child that has any type of food allergy has to take is so extensive.
There's no little reaction. Every reaction can end up in death.
You can teach kids to not share and just realize that this is their own food and they have their own snack, and just keep it to yourself.
It's incredibly hard for the children and the parents, and therefore just pay attention to what you're told and know that allergies are serious.
So until the wave of food allergies changes and they find some cures, then that is something we need to do, because people just don't realize it literally could kill a child. You don't want to put a child's life in jeopardy just because you want to be hospitable. And you don't understand that unless you have kids with food allergies. That's what's so challenging.
What else can you do? A friend of mine was actually hosting a birthday party for her daughter, and 2 kids with food allergies were invited. It was a drop-off party, but she asked me to stay, even though I told her it meant I would have to bring my other 3 children as well. She was terrified that one of those kids would encounter a food allergen and that she was going to have to use an epinephrine autoinjector and not know how. She wanted me there just in case anything went wrong. Obviously, having a pediatric emergency physician at every birthday party in the U.S. is not a feasible solution, but we can do things to try to make sure that kids with food allergies are more comfortable and that their parents feel a little more comfortable letting them out of their sight. Making sure children wash their hands after they eat, washing their face, teaching our children to be kind and inclusive of children with allergies and any other disability is very important. And making sure that teens feel safe, loved, and accepted can reduce some of the stress caused in people's lives by food allergies. In the world of food allergies, there's a lot of hurt, but there's also a lot of hope. And my greatest hope for the future is that these families will have a cure one day and that their children will either outgrow or be treated for these allergies in a way that will make them non-life-threatening at the very least. But my hope for today is that we've increased a little understanding, that we can show a little kindness, and that we can take extra steps to ensure that children with food allergies have a safe world to live in. There's hope for the future, but that hope starts with us. This is Dr. Lili with My Pocket Pediatrician. Don't forget to like this video, subscribe, or comment below and let me know what you think. Thanks for stopping by.
When the doctor says my child has a condition, I'll learn more at My Pocket Pediatrician.